Welcome to the birthplace at Providence Sacred Heart Medical Center. I'm Dr. Emily McQuaid, Chair of Obstetric Anesthesia.
And I'm Heather Christensen. I'm a nurse anesthetist. We are two members of the OB anesthesia team here.
And we're here to tell you about some of the services we provide during your labor and delivery.
When admitted here, you will come to a room like this.
We like to meet every patient on the labor unit, regardless of their birth plan. We want to get to know you a little in case you need us in an emergency, and to be better prepared to help you when or if you desire pain control during labor and delivery.
We will talk with you about your health history and prior experiences with anesthesia. We can then discuss your options for labor pain management tailored to your needs and medical conditions. These options include intravenous opioids, nitrous oxide, and an epidural or similar techniques.
In the case that you need to have a cesarean delivery, either scheduled or unexpected, we will discuss how we can help you have a safe and comfortable delivery in the OR. We want you to be informed of all of your options during this special time. Let's cover the various analgesic options that we can offer you for pain relief during labor.
Intravenous opioids are pain medications that are given through your IV catheter. They are usually a good option in early labor. You will still feel pain, but it will be lessened, allowing you to relax between contractions. Opioids can cause you to feel dizzy, drowsy, nauseous, or itchy. They also cross the placenta, which means they can affect your baby. Because of this, we refrain from giving them within an hour of delivery.
Another pain control option during labor is nitrous oxide. Nitrous oxide is an anesthetic gas that you administer to yourself through a mask. It's often called laughing gas because in addition to giving mild pain relief, it can make you feel more relaxed. Other common side effects are dizziness and nausea. Because of this, once you start nitrous oxide, you will need to stay in bed. It is not for everyone, but some women find that it helps take the edge off of contraction pains.
Nitrous oxide starts working very quickly when it is inhaled, and its effects stop quickly when you stop using it. Because of this, you can start using nitrous oxide when you feel a contraction building and stop it when the contraction is over. It also crosses the placenta, but because of its quick on-off effects, it can be used safely right up until delivery. However, because it only has mild pain relieving properties, it's often not strong enough as labor pains become more intense.
The epidural is the most common technique used for labor pain management, and for good reason. It is the most effective form of pain control we have to offer, and it has the least effect on your baby. An epidural works by placing a tiny, flexible catheter in the epidural space. This is the space where the nerves from your spine pass through on their way to your body. We then give local anesthetic and pain medicine through the catheter to numb those nerves as they pass through the epidural space.
The most important difference between an epidural and other forms of pain control is that the epidural blocks the pain signals before they reach your brain, allowing you to stay alert and clear-headed while still having excellent pain control. Another advantage of epidural medication is that very little of it enters your bloodstream or crosses the placenta to your baby. The disadvantage of the epidural is that it also numbs the nerves that you use to move your legs, causing weakness. For this reason, we require that you stay in bed when you have an epidural.
Not every epidural works perfectly. Some can be one-sided or give only partial pain control. We can usually get it working better by giving additional medication through the epidural, but occasionally an epidural needs to be replaced. There are some side effects and risks associated with getting an epidural. The most common ones are tenderness at the epidural site, low blood pressure, and itching, all of which go away on their own or are easy to treat. About 1 out of 100 women develop a headache after having an epidural. If you develop a headache that is related to your epidural, we can offer special treatment options. Anytime that we perform a procedure in the hospital, even just starting an IV, it is possible that more serious complications could occur, such as bleeding, an infection, or damage to something close by. We minimize these risks by carefully assessing your health history and placing the epidural carefully under sterile conditions.
The epidural is stopped after delivery and the catheter will be removed. The numbness in your legs will go away over the next several hours and you will be able to get out of bed again. In addition to our analgesia and anesthesia services, the Providence Birthplace offers assistance in relaxation and breathing techniques, jacuzzi tub, birthing and peanut ball, and a bed that can change configurations for comfort.
If your obstetrician has decided that you should deliver your baby via cesarean, there are 3 types of anesthesia we consider: an epidural, a spinal block, or general anesthesia.
If you already have a labor epidural in place, we can give you stronger medication to make you numb for the C-section. If you're having a scheduled cesarean delivery, or if you don't have an epidural in place, we usually choose to place a spinal block. A spinal is very similar to an epidural, except as a one-time injection. The risks and side effects are similar to an epidural.
With both an epidural and a spinal anesthetic, you will be able to be awake during surgery, and your support person can be with you in the OR. As long as both you and your baby are doing well, you will be able to see, hear, and even hold your baby soon after delivery.
Occasionally, typically in an emergency, general anesthesia is required for cesarean delivery. General anesthesia means being completely asleep with a breathing tube. Remember that the anesthesia team is there to ensure that your baby is delivered as safely and as comfortably as possible. If general anesthesia is necessary to deliver your baby safely, we will use it, but it's rare that we need to.
The obstetric anesthesia department is honored to be included in this special occasion.
We look forward to seeing you in the near future.